So, Ange, tell me a little bit about yourself and your involvement in this case.
Hi, my name is Ange Las Marias. That's my nickname. It's Arlene Angelique. Is my first name, and I'm a nurse, a registered nurse in New York, and I came from the Philippines, and I started like taking care of Miss Myra Goggins in June, and kind of like very happy to be valued as part of her your healing process, because we started when she has a deep pressure injury or pressure ulcer on the ankle and on the heel foot, which measured about like 5 centimeters back then, and the ankle is about like 2 centimeters, and it has partial loss of dermis and really like some exudates then. And we really have done well with, of course, Dr. Alan Bienstock's care and guidance on the treatment. So we started with Santil, and then daily wound care dressing, and then with normal saline Santil, and then the abdominal pads for the exudates, and there's Herlix and the Coban. And then that actually has been, been what is mostly what we use until like she has some rashes and some inflammation or redness that we have also treated under Dr. Bienstock's care with some antibiotics, and then we also applied some hydrocortisone. And for her pain, she also has a compound cream with lots of medications on it combined. And yeah, until like we changed some of the dressings from a Piona or collagen alginate, and then up to this time the last was the endoform, which really like helped out. And so now you can see the difference is that the wound has significantly reduced in size. It's like a quarter or even less. Like it's the what used to be the heel wound that used to be 5 centimeters is now like less than 2, or really like 1, and it's really nearly closing up. So it was, and then the ankle wound is also like closing up. It's also like less than 1 centimeter in size, and that is all attributed to the well wound care that has been done daily on the span of 3 months. But now it has somehow like we only do the like every other day dressing from now onwards.
What do you think made the big? What do you think were the big difference makers in Myra getting better? Both from her wound as well as her overall health.
Yeah, so she has a lot of care and a magnificent like team. She has a physical therapist and a personal trainer as well that helps with her mobility. And of course, she has nurses, a good team of nurses and doctors, and also like aides that help her throughout. So she's been like being helped with her transfers from bed to wheelchair and to her daily mobility. It's really like contributing to her overall recovery from the fall, and from from the pain, or all this from the inflammation and everything. So
what else would you like to add, or what other things do you think? What do you think we did well? What do you think we didn't do? What do you think we could have done better? And you can be self-critical of myself and yourself. I just the only way you get better is to critique yourself.
Yeah. So we did well on really like doing it aseptically, and then that really prevented aggravating or like further infections that she could have had, because like with the wound opening, it's always prone to anything, any bacteria that could have caused further damage to the skin or to the wound itself. And I think we have managed that, although and when I showed the picture to my colleague nurse, they could have said, "Oh, it's a non-healing wound," but we've proven that otherwise it's not really, because now it's healed up, and what could be done better is.
And there may not be an answer to that, but every case I do, I always say, what should is there anything I could have done differently? And sometimes you don't. It's okay to say that there's nothing I would have done differently.
Yeah, because like I've not. I mean, we haven't really established what caused the inflammation or the rashes when there was at some point. But yeah, we could have prevented that maybe. The allergy, yeah, she have had an allergy which was unknown. If it's could have been from a medication reaction, or from the cream, or there could be a. Yeah, you can say something.
The collagen therapy or the collagen thing.
Yeah.
We don't know.
We don't know. Yeah. So it's not conclusive.
Right.
And it takes the doctor to be diagnosing that way.
Yeah. It also, we don't know, and we may not know what caused it. Yeah. What would you, for patients who have wounds, or other nurses who have difficult wounds, what would you recommend, or like what would you like to say to them? Because we do in our world, we deal with a lot of patients who require help. Like what would you? It can be both wound related, non wound related. What would you recommend families and patients to do?
So if families who has like family members that has wounds, they really have to consult a wound doctor, and really have it checked before it could aggravate. The infection could aggravate, especially if the client is actually diabetic, then it could have really gone worse. In that case. And they should have a wound nurse who would, do the wound care on a daily basis or as needed. Mm-hmm. And then they should have the right amount of supplies, and also everything in it, like nutrition wise, like protein intakes for the family, or diet that's recommended by the doctor that could help in the healing process of the wound. And also they should also get some help with the mobility issues, especially that if the client is bedbound, then someone has to come in as an aide to actually do the repositioning, because this way we are preventing more pressure injuries, let's say sacrum, which is very prone to people who are bedbound or wheelchair bound. So a lot of offloading should be done, or could be done, to avoid all this pressure injuries to occur or to surface.
I'm going to ask you another question. What's also important? So you mentioned amazing things in terms of having the family involved, having a nurse involved, and doctor. But what do all three of those things have to happen between all those three things?
Oh, the patient should also be very much involved and willing to do everything, right. For her recovery, or right. his or her recovery.
Also, what has
starts from
of course, the patient's very important, and the patient needs to be involved. But one thing is, because I'm sure you see this, like there can be a physician involved, there can be a therapist involved, there can be family involved, and there can be a doctor involved. But what has to happen with all those components?
Go ahead.
Besides that, yes, that's of course yes. But amongst them, how do they have to work?
Oh, they have to work in congruent to each other. They have to work harmoniously. They have to. Everyone has to be involved. So communication is very key. Yeah. To involve everyone on what's happening from day one up to the progress has to be communicated across the interdisciplinary team. Right. That involves the doctors, the nurses, the physical therapists, who else? The aides, and the family members. Of course, they're all the clientele, and Meyer Goggins.
Yeah. Good. That's perfect.
Yeah.
Thank you for sharing that.